Welcome to today's presentation, Who Moved My Stent? Manage Your Cath Lab Inventory Efficiently, sponsored by a grant from Cardinal Health. I'm Max Green with Becker's Hospital Review. The program will begin with a presentation and we'll have a question and answer session following completion of the presentation. You can submit any questions you have throughout the presentation by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. Our presenter will attempt to answer as many questions as he can during this time, but any unanswered questions will be answered offline Cardinal Health team. You'll receive an email with instructions about a week following the seminar for how you can download a copy of the presentation. You'll also receive a follow-up email shortly after completion of the program. You can submit your feedback or any additional questions at that time. This email will not include the presentation. It's a question that comes up all too often in cath labs with the growing volume of minimally invasive cardiovascular procedures now being performed in the procedural suite. As healthcare reform drives quality and cost and tightens budgets, hospitals need to be prepared to have the right inventory on hand when needed while striving to increase efficiency and reduce waste. It's now my pleasure to introduce today's presenter. Ken Shastany is a Strategic Solutions Specialist with Cardinal Health Inventory Management Solutions and joins us today as our thought leader. He'll be discussing the challenges of managing high-cost implantable devices and physician preference items, as well as the strategies for right-sizing cardiovascular inventory with automation to enhance utilization and reducing variability. In addition, he'll share the story of how Cardinal Health's customer, Florida Hospital, gained greater control of their cardiovascular suite inventory with an RFID-enabled inventory management solution. It's now my pleasure to turn over the floor to Ken to begin today's presentation.
Thank you, Max, and good afternoon, everyone. Thank you for joining us. In my current role, I help our customers improve patient care, safety, and clinician workflows through inventory management solutions. I'm here today to share insights on how you too can improve your cardiovascular suite inventory. I have been a registered nurse since 1982, and the majority of my career was spent in cardiovascular-focused roles, from procedure nurse to CV services administrator for organizations such as Brigham and Women's Hospital, Tufts Medical Center, and Hallmark Health. We had planned to have one of our customer advocates from Florida Hospital Cardiovascular Institute with us today to share their success story firsthand on how they were able to cut more than $5 million of waste out of their 13 interventional labs. But unfortunately, due to scheduling conflicts, they will not be able to join us. However, as one of their strategic consultants, I helped them resolve their inventory challenges, and I will discuss their case story and share some of their insights. But to start off today's presentation, I'm going to first discuss the trends that are driving change in cardiac cath labs, the challenges of managing your inventory, the impact that these trends have on your own facility, and above all, how to overcome these challenges with automated inventory management. By taking this approach, you can not only improve efficiency and save money, but also free up more time for your staff to take care of patients. To help us get there, I'd like to give you a brief overview on Cardinal Health and our mission. At Cardinal, we help our customers focus on patient care by working with them to reduce costs, enhance efficiency, and improve quality. Our patient-first approach has helped us gain wide recognition, including being named by Gartner as a top leader in healthcare supply chain innovation for the past 5 consecutive years. We understand that supply chain doesn't stop at the hospital loading dock. That's why we're committed to helping hospitals drive the business of inventory management from the manufacturer to the point of care and all the way to the patient's bedside. It takes deep supply chain expertise and a strong culture of Lean Six Sigma to make this happen. To maintain our patient focus, we challenge ourselves every day to innovate, create value, and relentlessly pursue operational excellence. By doing so, our customers can gain more time back to focus on what matters most, not only the business of supply chain, but the business of healing. Make no mistake, there are many healthcare trends that stand in our way. Let's take a look at some of them. Everyone knows that the healthcare landscape is changing rapidly. And one of the biggest examples is the change in reimbursements. For your hospital or your health system, the impact on cardiovascular services should be of particular concern, given that your service line represents high volume, high value procedures. Here are 3 trends or factors that are putting your reimbursements at risk. The first trend is value-based purchasing, or VBP. The Centers for Medicare and Medicaid Services has 3 stated aims with VBP: better care for individuals, better health for populations, and lower per capita costs. As healthcare moves from a fee-for-service to pay-for-performance model, where the focus on quality and efficiency is rather than the quantity. This transition, along with the growth of accountable care organizations, is fundamentally changing how health systems must manage the high costs of cath labs. The next trend is the high exposure to VBP reimbursement measures. A large percentage of core measures for VBP are based on cardiovascular components due to the fact that cardiovascular care accounts for 40% of Medicare dollars spent. 6 of 19 measures directly impact your quality performance in the cath lab setting or post-procedure. Remember, the evaluation of reimbursement is based on 3 dimensions: the quality of outcomes, the clinical process of care, and the patient experience of care. Finally, there's greater scrutiny of the cath lab overall, as financial and quality performance have become a greater determining factor for reimbursements more than ever before. Physician reimbursements and bonuses will be increasingly tied not only to the VBP metrics already discussed, but also to the financial performance of the lab. While reimbursements are at risk, so too are revenues, particularly as physicians attract cardiac cath lab procedures away from hospitals and into their own offices. According to one analysis, a migration of just 50 to 60 patients in a year could drain $500,000 to $600,000 worth of hospital revenue. In addition, the multifaceted aspect of the cardiovascular suite has expanded to take on roles that traditionally belong to other departments, including interventional radiology, electrophysiology, interventional neurovascular radiology, vascular, and cardiac surgery. This new reality has created a cultural change in the cath lab as you move beyond serving cardiologists alone. As surgical interventional therapies come together, the birth of the hybrid OR and hybrid cath lab has created new challenges that impact inventory management, efficiency, cost control, and patient care. Also, the trend of growing complexity in the types of procedures that cardiac cath labs are performing today, such as transcatheter aortic valve replacement, or TAVR, with extremely high-cost products replacing open thoracotomy. Given the cost and complexity, margins on the TAVR procedure reimbursements are tight. Other complex procedures now seen in the cath lab include renal denervation to treat drug-resistant hypertension, transcatheter repair or closure of atrial and ventricular septal defects, cardiac assist devices such as LVAD and BiVAD placements, and more. In short, as more procedures move out of the OR and into the cath lab, this growing complexity will continue to fuel an increase in cath lab procedure volume and the need to carry a larger, more diverse, and more expensive inventory. Today, health systems are being challenged like never before to lower costs while improving the quality of care. The consequences for not achieving this goal are clear. Health systems that don't earn the required quality scores face mounting financial penalties and lower reimbursements. This is why health systems are stepping up their priorities around the triple aim of patient safety and quality initiatives, while focusing on clinical and operational excellence to drive financial improvements across the continuum of care. Now, what I'd like to do is to get a feel of who's in the audience. I'd like to take a quick poll.
All right, we will now poll the audience. You can participate by selecting the best answer or answers on your screen. We're curious to know, how is your facility currently managing high-cost cardiovascular inventory? You may choose multiple items from the following responses: no formal system or intuition, manual or periodic physical inventory, an automated cabinet system, a barcode system, or RFID tracking. We'll give you a few more seconds to answer before we close the poll, and Ken, I will turn it back over to you to discuss the results.
Okay, great. Hey, thanks, Max. Not a surprise, as everyone can see, about 70% of our respondents are saying that they use manual or periodic physical inventory as their main approach. And that's really not surprising. I guess what is surprising is that only 6 are kind of using intuition, which I've seen a lot of labs out there in my travels that use the Radar O'Reilly method, which if you remember your MASH episodes, he would remember when helicopters are coming in by intuition. So I think that there's a lot of that out there as well. All right, great. So thanks. Let's move on to the next slide. Perfect. Okay. So I guess the question at the end of the day is, what does this mean to your cath lab in particular? As I just mentioned, there's new and increasing pressure to reduce cath lab spending while improving care coordination and patient outcomes at the same time. Because cath lab shelves house high-dollar products, you're tasked with finding new ways to more effectively manage these items. This includes streamlining inventory, minimizing expired products, and increasing charge capture. You also need to manage the new reality that while physician preference items represent most of your supply spend in the cath lab, physician choice may become more limited under healthcare reform. Speaking of the new reality, you also have to understand that financial risk and costs are shifting from payers directly to your healthcare system. Add it all up, and your health system and cath lab need a new source of savings and efficiency. A lot of this responsibility is now falling on the shoulders of those who manage supplies, especially high-value inventory in your cath lab. The question to ask yourself is, how efficiently is my team managing these supplies in the cath lab? Historically, cath lab inventory has been managed in the department by the clinicians instead of supply chain professionals. The reason is simple, but it creates a daunting problem. To help maintain good physician relations, purchasing decisions are often left in the hands of the clinical team. This is especially true for the high-value physician preference items that are as much as 80% of your supply spend in the cath lab. That means that the large expense is managed by those who naturally focus more primarily on physician relations and quality patient care, and often minimize the need to drive financial improvement. While this model may have worked in the past, today's cost pressures require a cultural change. Today, supply chain professionals and clinicians must build more trust and collaborate more closely to make the right purchases for lowering costs while improving care at the same time. I've seen firsthand health systems that have done just that, working together to improve supply chain operations in the cath lab. The result is more efficiency and better care. Cost-effective care and clinically effective care are not mutually exclusive. Progressive customers, like Florida Hospital, are using advanced data analytics for value analysis committee decisions and to set appropriate par levels, product selection, and accurately understand utilization. Using real-time data on every single item, the historic usage patterns drives decisions that are evidence-based and not intuition-based or emotionally driven. By making this change in your own cath lab, you'll begin to overcome the major barriers that stand in your way of achieving cost and clinically effective inventory management. So what are these major barriers? Here are 5 of them. We call the first barrier emotional stocking. This is stocking products based on intuition rather than actual utilization based on clinical demand. Emotional stocking leads to overstocking, driven by physician preferences and product variability. For example, ordering multiples of every size stent from every manufacturer. As a result, as much as 60% of your inventory could be unnecessary, but you still stock it, just in case. Emotional stocking often leads to overstocking outliers. The what ifs, what if a stent is dropped? What if the physician needs it? We've always had it. I have been in cath labs where the tech managing inventory doubled the bare metal stent par levels and purchased over 100 stents because he didn't want to get yelled at again for being out of stock. The second major barrier is manual processes, which kind of feeds back to what we were talking about in the poll question. It is critical to fix it to help you focus more on patient care. It's been reported that nurses and/or techs spend anywhere from 6 to 20% of their time hunting and gathering supplies. Plus, some labs do not have dedicated inventory management staff, so clinicians are tasked with inventory management and performing physical inventory, which means they have less time to care for patients. As a former cath lab special procedures staff nurse, it was my responsibility to have my lab fully stocked, but I didn't like having to count wires and spend time away from the patients on inventory management. One hospital I recently visited cut inventory management costs by eliminating the supply coordinator. Guess who ended up taking over those responsibilities? Naturally, it was the clinical staff, whose salary is easily triple that of the inventory aide. The quote, savings was simply a shifting of work and not a savings at all. It is also critical to note that manual processes are inherently inaccurate and can impact patient safety and care. Stockouts, expired or recalled products left in inventory can lead to dire consequences, which we'll discuss shortly. The root of the problem is relying on inaccurate and redundant manual processes, which also leads to our next barrier, which is around charge capture inaccuracies. This occurs when clinicians record product consumption manually, often by peeling off labels and placing on billing sheets, which make the charge capture a lower priority than patient care, which it should be, but it also opens the door to human error. Documenting usage in the hemodynamic system or cardiovascular system is only as good as the data input and ease of collecting it, and the lost revenue can really add up. The fourth barrier is expired, obsolete, and recalled products. Research has shown between 10 and 15% of all hospital supplies wind up expiring before they are used. Therefore, your cath lab could be wasting a significant amount of budget on expired or obsolete products that don't move. Full visibility into your inventory can help you effectively and proactively track all three of these in your cath lab. Otherwise, it can lead to patient safety issues, as well as unnecessary costs. And when it comes to patient safety and cost management, having an automated system that is 80%, 90%, or even 95% accurate is just not acceptable. While 95% accuracy may sound good, this could mean that 5 out of every 100 devices are not adequately tracked. This also means that 5% of the products that you carry may be expired or recalled without you knowing it. Think about the impact if you're carrying an owned inventory valued at around $2 million. This could translate to $100,000 in loss. Not only is the risk financial, but when it comes to patient safety, there is no room for error. The fifth barrier is consignment inventory. Again, it's the risk of carrying too much inventory and not having what you need on hand based on utilization. Keep in mind that the goal of effective inventory management isn't to have the most of something you don't need on your shelf, but to have the proper amount of those items that match your actual usage, not your vendor's hopes. You need fact-based intelligence to right-size your inventory, including your consigned inventory.
All right, we will now poll the audience once again. You can participate by selecting the best answer or answers on your screen. The next question is, where are your major barriers to inventory management in the cardiac cath lab? You may choose from the following responses, and you can choose multiple responses here again. Emotional stocking, manual processes, charge capture inaccuracies, dealing with expired, obsolete, or recalled products, or consignment. We'll give you a few more moments to answer before we close the poll, and then Ken, I will turn it back over to you.
I'm just going to give you a couple more minutes, a couple more moments before we respond to your answers, and here we go. So again, manual processes, nudges out and becomes the winner. So manual processes, emotional stocking, and managing expired, obsolete, recalled products are your biggest problems. And that's really not a surprise, because I think all of those kind of follow with manual processes as the basis for your strategy. So that's kind of the whole point of this meeting, is so we can show you where an automated solution can help eliminate all of these factors for you. All right, now let's discuss how you can refine your inventory programs to support your AAA initiatives around cost, quality, and outcomes. For health systems and their cath labs across the country, the answer is developing a new strategy that strives for supply chain excellence. It has 4 components. You should first start by creating end-to-end product visibility. Without it, you would have a difficult time knowing for sure how much inventory you have on hand, not to mention identifying products at or near expiration or those being recalled. And managing recalls is a tremendous challenge. According to the FDA, there were nearly 1,200 product recalls in 2012 alone, and 99% of these were handled manually. The second is aligning priorities. That can be challenging for the cath lab director, who must balance the need for improved product visibility and eliminate waste while helping clinicians focus on patient care. The good news is that both the supply chain and the clinical teams share the same common goal: improving the patient experience. Now it's just a matter of clearing up the confusion about who's responsible for what in order to impact that experience. Next, you need to seek process improvements. As we've been discussing, relying on manual processes that are cumbersome and repetitive don't solve any problems. They create them. Finally, and most importantly, driving more informed decisions through analytics. This is using the power of data to light up the supply chain from end to end, revealing and sharing inventory and utilization information at every touch point. When you do, you'll have the confidence to make informed and effective decisions that lower costs, improve efficiency, and give more time back to clinicians for patient care. That's what we mean by creating a strategy of supply chain excellence. So how do you get there? For a growing number of health systems and their cath labs, the answer is to automate supply chain and inventory management and align clinical and supply chain initiatives and make more informed decisions through the power of data analytics. Now, the ideal solution must address the sheer scope and complexity of your supplies and have the right inventory tool for the right inventory product, as you see here. So, for example, 2-bin Kanban and barcoding are well suited for low-value supplies. But for high-value items, such as implantable devices, you'll want richer, real-time data to track inventory levels and utilization. So RFID technology, cabinets, and wands are the best practice solution. What does an automated workflow look like in the cath lab? Here's an example, which includes the steps from point of receiving and tagging with RFID to the point of use, followed by the signal for reordering. This solution is designed around clinical workflows and driving operational excellence around the entire process of receiving, using, and tracking supplies. The clinician-friendly tools and processes streamline data gathering, helping to support both patient safety and time for patient care while driving down costs with an automated system that facilitates near-perfect inventory management accuracy. Let's take a closer look at this workflow. The first step is to tag. Tagged items are waved in front of a reader to register the tagged item into the system. This links the unique ID on the RFID tag with product barcoded information from manufacturer, including model, serial, lot, and expiration date. As mentioned before, a growing number of manufacturers tag their products for us so they're arrived all ready to register. Or your materials team can quickly tag the exterior packaging for each item. It takes about 10 seconds per item, and when you compare this to the thousands of automated sites being enabled, this is a relatively small investment of time. The next step is to store the items. The items can be stored in a variety of smart cabinets with built-in readers, and these cabinets count and record their own inventory every 30 minutes automatically. Cabinets are available as open, manual, or RFID locking doors for track and trace. Or if you prefer, these items can be stored on your typical hospital shelving, and you can use a smart wand to perform the same kind of inventory. Unlike a barcode reader, where you have to scan individual barcodes, the smart wand can read up to 75 separate tags simultaneously, meaning you no longer have to have line of sight to count these products. This would result in the material staff being able to count an entire room in just a few minutes. The product next is used, and that is at the point of use, inside or just outside the procedure room. The RFID tag product is waved by a workstation reader. As discussed, the real power of automating your cath lab inventory management is predictive analytics. Imagine having the online tools to easily conduct deep, granular analysis of your cost per case by physician, by location, or by supplier. You will also be able to have real-time data around on-hand inventory status and costs, age of inventory, and predictive tools that will show you what products are at risk of expiration in the future. You will reveal new opportunities to reduce variability and improve efficiency. You will have better data to manage consignment, bulk purchases, and rebate agreement compliance. Advanced analytics empower you to take full control of your inventory for the first time and keep you from wondering who moved my stent. This represents just some of the analytic models that we use at Cardinal Health Inventory Management Solutions.
All right, we will now poll the audience one more time. You can participate by selecting the best answer on your screen. We're curious to get your feedback on the following statement. I believe our hospital has good visibility into our cardiovascular inventory. Do you strongly agree, feel neutral, disagree, or strongly disagree? We'll give you a few more seconds to answer before we close the poll, and then Ken will take it away.
Thanks, Max. Okay, so people are pretty much split right down the middle on this one, where it's a fairly neutral statement. So, but even still, that's only at 35%. So there's only about 33% of you out there believe that your hospital has good visibility of your inventory. So that's actually pretty surprisingly high number. So we'll move right along. Now let's turn to an example of how our solution works in the real world. We're going to talk about Florida Hospital now. So 7 years ago, the Cardiovascular Institute at Florida Hospital put RFID inventory management to the test in their cardiovascular suite when they opened the Ginsburg Tower, a 15-story cardiac tower that houses 440 patient beds. Florida Hospital had conducted an evaluation of an integrated system in its electrophysiology lab to track various medical devices such as pacemakers, defibrillators, diagnostic and navigation and ablation catheters. The pilot's goal was to achieve accurate and timely inventory data that would enable the department to reduce its device and equipment inventory by $30,000 to $40,000. The system allowed the department to do even better than that. It reduced on-hand inventory by 37%, improving visibility and saving the hospital over $150,000 through the pilot. After a successful trial in the EP lab and the smooth integration of the inventory with their native cardiovascular inventory system, the comprehensive solution was then installed in the new tower with a 10-room cath EP lab and shelved space for 5 additional OR-ready suites. As a result of the integration, Florida Hospital is experiencing inventory optimization that has cut more than $5 million of expense to date, reduced billing errors, and streamlined workflow for the front-end clinical staff. The use of RFID in the overall process ensures the accuracy and timeliness of captured information with no manual intervention required. It has been a boost to the hospital as it offers better control over supply chain as well as improved accuracy in patient billing. At the same time, the streamlined workflow means clinicians can now spend more time on patient care and less time on manually tracking inventory and product usage. Success was ultimately defined as an improvement in clinical staff satisfaction, ease of use, enhanced patient safety, and operational and financial improvement. This would not have been possible without the hard work of the inventory, billing, materials, and clinical staff of the Cardiovascular Center. Florida Hospital now has greater control and the ability to track inventory automatically from the manufacturer all the way to the procedure room and patient's bedside, which eliminates a lot of waste and takes all of the guesswork out of making inventory decisions. Based on new practices and the frequent changing of preferred brands used by their physicians, data is helping Florida Hospital predict what supplies will be needed in their CV suite. They're able to review trends and modify their purchases to meet the demand, as well as reduce overstock and decrease their spending. Discussions with physicians regarding which brands and product lines to stock are evidence-based and no longer emotion-based. We have seen the conversation turn from the belief that we need to stock this item, I use it all the time, to the data shows that only one of these items has been used in the last 3 years, and that was 2 years ago. By having the ability to identify each individual physician's usage of any product instantly without report writing or cross-referencing multiple data sets, administrators now have the tools to impact the bottom line without impacting care. And it's reducing their costs and their risk with bulk buys by identifying exactly those products based on the hospital's usage. Florida Hospital can calculate the appropriate volumes and specific sizes of products to purchase for a set period of time, dollar value, or amount. Traditionally, it had been up to the device rep to create this shopping list for them. Now the hospital is in control of this process and can track each item from a bulk buy to confirm its usage and its status. Patient safety is also enhanced with alerts to better manage expired, recalled, and obsolete products. The system also has improved charge capture by making it easy for clinicians to scan products and charge patient accounts at the point of use. From an operational perspective, Margarita Rivera, Administrative Director of CV Supply Chain, states, "Dynamic reporting tools have simplified day-to-day decision-making with real-time information at my fingertips, and that trending information is clearly visible, helping with the constant changes in the aggressive CV market. Purchasing information makes bulk transactions a breeze, showing exactly what is needed." With their RFID automated workflows, Florida Hospital has been able to tighten supply chain budgets, streamline workflows, reduce inventory, and add over $1.7 million in annual savings in the cardiovascular space. Florida Hospital is just one of the many powerful examples our customers have shared with us of how our automated inventory management solution works to cut waste, improve efficiency, capture lost revenue, and support patient safety and quality initiatives. Now more than ever, having this power at your side can support your growth initiatives as your health system faces the challenges we've been discussing today. Building a supply chain excellence strategy, driven by lean management and advanced analytics, can dramatically advance your cardiovascular suite. The time for automated inventory management is here, and we're ready to help you deliver. Thank you again for all your time and attention today. We'll be happy to now take your questions.
Thanks, Ken, for a very informative and enjoyable presentation. We'll now begin the Q&A portion of the program. As a reminder, you can submit any questions you have by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. Our presenters will attempt to answer as many questions as they can during the time we have for Q&A, and we'll follow up with questions they do not have the opportunity to address. So Ken, let's start with, how is this RFID system different or better than a barcoding system?
Max, that's a great question, and we get that a lot. I think a lot of people are very familiar, based on the polling questions that we saw earlier. There was a fair number of folks that are using barcode as their inventory tool inventory management tool. And I think that one of the key differentiators between RFID and barcode is that barcode requires line of sight and requires an interaction with the specific item every time you touch it. So, for example, if you're going to move a barcoded product from one storage location to another, you have to sign it out of one area and scan it into the next area. The other piece is that, again, it requires line of sight, so you're going to have to touch every single item if you really want to capture the full accurate data, specifically around lot, serial, and expiration on these products. RFID does not require line of sight. The RFID tag is a proximity tag. Basically, when that RFID tag is in a RF environment, the ID can be read, and that RFID tag is essentially a license plate and for that specific product. And if we store all of the information, the lot, serial, expiration date, and the model number in our system, you don't have to see the specific barcode in order to read all that information. So we're automating that read function, because if you think about the accuracy, if you're scanning an RFID tag with a smart wand, you can read 50 tags in about 3 seconds, versus a barcode scanner where you could probably only read about 2 or 3 products per second. So we're going to increase the efficiency and accuracy by using RFID.
And does each product need to have an RFID, and how does RFID work with individual products?
Okay, great question. And the simple answer to that is no, not every product should have an RFID tag. It doesn't really make a whole lot of sense to put an RFID tag on a sheet that costs you $2, $3. We reserve the RFID tagging and RFID technology for the higher dollar products. We talked earlier about the lower dollar or commodity products being best managed using either two-bin Kanban or by using barcode scanning, because those are the products that if you're overstocked on those items, it's not going to be a budget buster and it's going to be okay. Whereas if you're overstocked on the expensive things, the $1,600 stent or the $7,000 pacemaker, that's a really big problem. So we look at tracking the high dollar stuff, say $50 and up, or products that are chargeable, using RFID to track those items, because those are the things that you need a lot more richness of data and accountability for.
And what is that process like? How do you RFID tag those items that are coming through the door?
Actually, this is quite easy. So the folks that are currently using barcode-only tools are doing a similar process to register product into their system. The only difference that we're doing than they are is we're adding an RFID tag to the package, which is just basically, if you can put a stamp on an envelope, you can put an RFID tag on a box. And there's the registration process is simply scanning the manufacturer's barcodes on the package, and then associating that information by that RFID tag, essentially waving that RFID tag by a reader. The application makes that association, and that whole process of tagging and registering a product into the SIMS solution literally takes maybe 10 seconds per item. So it's not a very onerous, time-consuming work step. It is new work, but what it will replace is downstream work such as having to go and do a physical count, looking for those short-dated or expired products, looking for those recalled products, because now you have the data tools that are going to tell you all about those things.
Great, thanks, Ken. Are you able to next talk a little bit about how much the solution costs and how it's priced out?
Sure. So that's always a question whenever you are first meeting with somebody, that they believe that the cost is going to be prohibitive because it sounds like a lot of technology. And basically the solution cost is based on a bunch of variables, mainly the fact that based on the number of pieces of hardware and the type of hardware that you're going to be using in your lab. So naturally you would expect a lab that has 10 RFID-enabled locking cabinets would have a bit more of an expense than a lab that is only using a smart wand and point-of-use readers. So the cost is still is variable based on the size of the department and the amount of equipment that is the hardware that is going to be provided. But the important thing to know is that there's also a return on the investment. And what we like to do is when we provide pricing, we also talk about the return on investment, where basically we have seen historically with all of our customers that the system has essentially paid for itself in 8 to 12 months. And we look to work with you for about 5 years. So generally, your return on investment, the payback is less than a year, which is actually quite phenomenal in the hospital environment. And that is a really typical achievement for us right now with the ROI.
And will the technology link with the current system the hospital or lab is using? And how does it link with hemodynamics and other similar interfaces?
Sure, great question. So we grew up in the cath lab as a product, the SIMS product, and I've been with the company now for just about 10 years. And when I first was working in the cardiac cath lab and I had the inventory management solutions in my lab, my biggest complaint about them was that my staff were having to do redundant work. And one of the barcode solutions that I was using required me to essentially recreate all the same data that we were entering in our hemo system. And my staff just weren't going to have any part of that. And I don't blame them. So what we attempted to do, and I think we've succeeded, is we have integrated our solution so that we're trying to streamline the input of data into your existing systems where we want your staff to work. So, for example, in the cath lab, the point-of-use readers, which are basically the touchscreen computer with an RFID reader that is inside the control room, is sitting adjacent to your Mac Lab or your WIT Series 4 or your Philips Expert or your McKesson or Merge, whatever hemo system you're using. We are sitting right next to that. And when the staff use a product that has an RFID tag on it, they simply wave the RFID tag by that reader. And what we do is we have a connection from our point-of-use device, a physical connection into your hemodynamic system. So we are basically sending a signal into the hemo system that it sees the RFID tag as a barcode. So you're leveraging the native ability of the hemo system to document when you're waving the RFID tag. And I think it's really important to know that we are the only company that is doing that. That's a proprietary hardware and technology that we are the only ones who can do that right now. So that's a physical connection into those hemo systems. We also have interfaces, software interfaces, where we can have coded data flow from our system. So you could have usage information go to an interface server that will feed into your billing system or into your EMR, or we also have interfaces that can connect into your materials management systems, your Lawson's, your PeopleSoft, your McKesson, where we can send replenishment signals based on demand on what you need to reorder to get back up to your replenishment. So we have physical integrations and we have software interfaces, and all of this is based on a cloud platform where a subscription model, and the IT department is not having to put in any hardware in their server room.
Okay, we've got a comment and a question from an attendee here. One of my biggest challenges is charge capture. So how exactly does your system solve charge capture issues?
Okay, great. So I kind of touched on it a little bit just then when I talked about our integration with the hemodynamic systems. But what we can do with all of the RFID product, and if you wanted to track barcode product as well at the point of use, because we do know that the diagnostic catheters and wires and say things under $50 still do have charge implications. We can capture that information at the point of use reader by either scanning the barcode on non-tagged products or waving the RFID tag by the reader for the RFID tag product. Every single product that we are storing in our inventory that we're monitoring for you will have your item master number associated with it, and in this case, more importantly, your charge master number associated with it. So we can automate the charge capture by sending into your billing system through that software interface, that cloud-based interface. We can send those charge master numbers for all of those items that were consumed during a case in a what we refer to as an encounter report. The other way that we can facilitate charge capture or enhance charge capture or identify charges that may have otherwise been missed is by identifying products that are missing. So, for example, because the RFID tags products are sitting in a smart cabinet, if they go off of that cabinet and are not waved by a reader that tells the system it's been consumed, they'll show up as missing as an alert on the home page or the dashboard for the users. And what you could do is you could take a look at those missing products and you could see when they went missing, the things that went missing or that were used around the same time, and use that as an audit tool to find lost products that may have been used during a case that weren't waved by a reader. Our experience has shown that 98% of our customers are complying with the waving of the products, and that other 2% is where there's additional charge capture opportunity because we're able to note that things were taken but weren't used.
Great, thanks, Ken. We are coming up on time, so it looks like if we can squeeze in one more, we have a question here. If you were able to identify the top 3 priorities for getting started, what would they be?
Yeah, that's a really good question. And I think that the very first thing that I would do as a lab manager, I would ask or try to figure out what are those things that are keeping me up at night. Is your biggest concern right now, are you losing a lot of revenue opportunity because your billing sheets, or you're not automating a lot of those the billing process, or did you have a near sentinel event where you may have put in expired products? What is the major concern that keeps you up at night? And that's the thing that you need to address. So I would take a look at your problems and prioritize them on how you want to fix them in the order that is of biggest concern to you. The next, I would say, and this could actually be interchanged with the first one, not just identifying your problem, but making sure that you're protecting the right stuff. So I've seen a lot of hospitals where the materials department, because they're focused on a lot of the commodity type items, they want to solve that problem first. That's probably not the most cost-effective target for you. I would focus on the high-dollar products and manage your high-dollar inventory because, as we mentioned earlier, 80% of your supply spend are those physician preference items. Make sure you're tracking those. Make sure you're not wasting those. You know, if expiration's a problem, that's where it's going to kill you. So make sure that you're going after your highest dollar stuff. And then the last part I would also say is look at the shrinkage of your inventory. Where is the stuff going? Do you have a full accounting of it? Do you know where all of your product is? I mean, I think that a dirty little secret of a lot of cath lab managers might be that, you know, you may end up writing off 5% of your inventory every year if you're lucky, because you don't know what happened to it. You bought something, could have been borrowed by another department, could have been borrowed by a vendor for another hospital. You don't know. And that's kind of just the reality. This tool will now give you the visibility into every single item, so you're no longer having to worry about what happened to these items. So I would just, you know, make sure that you're protecting your biggest dollar stuff first, and you're being honest with yourself about your biggest challenges, and that you are serious about solving them.
Great, thanks, Ken. And unfortunately, it looks like that's all the time we have for today, but a reminder that Cardinal Health will follow up with any questions that we didn't get to. I want to thank Ken again for his excellent presentation and to all of our attendees for participating. We look forward to having you join us for future webinars. That will conclude today's program, and everyone have a wonderful afternoon.